So let's start at the beginning. All right, so early childhood. So what's happening? This is when the brain is growing the fastest than at any other time point. In the first few years, a young child's brain is making more than 1 million neural connections every second. And what is most important here? 3 things: nutrition, especially the first 1,000 days. And I think that's quite important because first 1,000 days has really been a very important policy stance that has been around now for about the past 5 to 10 years. Stimulation, so that's early childhood education, so talking, playing, reading with children, and then protection, largely from infections, but also from malnutrition and neglect. And in Kenya, there, as in many parts of the world, that there are still challenges related to these 3 aspects that really impact children's early brain health. Stunting still affects many children. There's still quite high rates of vaccine-preventable illnesses, and there are gaps in early childhood education access, particularly in rural areas and in informal settlements. So what's interesting from the perspective of media and journalism is that stories about child health are stories about lifelong brain health. If you're reporting on malnutrition, if you're reporting on school feeding programs or early childhood education, you're reporting on brain health. What happens to a child at age 2 will affect them and their cognitive capacity at age 20 and their dementia risk at age 70. So you can make explicit connections to that in your reporting. And here's a question I'd like you to think about. You don't have to answer it, but just sort of let it percolate. Is when was the last time you covered a child health story? And were you able to connect it to brain development and lifelong impacts? That's the sort of framing we are hoping that you're going to start thinking about and the connections you're going to start making during this training. Okay. Then we have school age and youth, which is, for us, we consider that to be age sort of 5 to 25. And here's something that you may not be aware of, you may, but you may not, is brain health the brain continues to develop well into your mid-20s. The prefrontal cortex, this is the part of the brain that handles decision-making and emotional regulation, still matures well into your 20s. And what matters at this stage? Again, education. So every year of schooling builds what we call cognitive reserve. It's a buffer that protects against dementia and other neurodegenerative conditions decades later. And education is one of the single strongest protective factors that we know of. Secondly, mental health. Depression and anxiety often emerge in adolescence and young adulthood. And in Kenya, mental health services for young people are severely limited. Stigma, this is not unique to Kenya. This is common also in South Africa, where I'm from. Mental health services are limited, particularly in the public sector. Stigma is high, and many people will suffer in silence. And then third, head injuries, especially from road traffic accidents, which are known to be a leading cause of death and disability for young Kenyans. And also substance use, which can also harm the developing brain. So for you as journalists, again, youth mental health is brain health. They're not sort of separate things. And I appreciate, Wycliffe, I think you were talking about both mental health as part of brain health. But basically, when you're covering mental health, you are covering aspects of brain health. When you cover school dropout rates, when you cover road safety, substance use, mental health challenges, you're covering aspects of brain health. The young person struggling with depression today faces an increased risk of cognitive problems in later life if untreated. And these are things that you can connect your dots to when you're reporting, or if you're looking for particular angles in your reporting. Why should people continue to care about issues like road traffic accidents or unsafe transportation? Being able to bring a new angle to it may be very interesting for your editors and your newsrooms, and brain health is one of those. All right, midlife. This is going to be an area we come back to quite a bit, and it's really ties into the reason we decided to work with the NCD Alliance. But basically in your middle years, and I'm going to say your middle years are not 25 to 64. They're a little bit older than that. But for the purposes of this, I've sort of split it and called midlife from 25 to 64. So if you're in your late 20s, please don't panic. And if you are in your early 60s, you can feel sort of pretty happy that you're still considered midlife. But basically, this is a prevention window. This is when many of the risk factors for later brain problems emerge. And what's probably really useful is to understand that cardiovascular health really is brain health. Some of the most important modifiable, and when we say modifiable, things you can do something about, risk factors for brain disorders in later life: high blood pressure, diabetes, high cholesterol, obesity, physical activity, smoking. They impact heart health, and they also impact brain health. And they directly increase your risk of both stroke and dementia decades later. So as you know, in Kenya, we're seeing non-communicable diseases rise rapidly. And you also know that many Kenyans still don't know what is their blood pressure, what is their blood sugar. They're often diagnosed quite late, and treatment availability and treatment adherence can be challenging, particularly in the informal sector, where things like workplace health programs are very limited. Now, what's quite helpful, I think, for you as journalists is that you are already covering a lot of stories that would be considered brain health stories. When you write about high blood pressure, when you write about diabetes and obesity, again, you are writing about brain health, and you can make that connection explicit. You don't just have to say diabetes increases the risk of heart disease. You can say diabetes increases the risk of heart disease, stroke, and dementia. So you're already doing this work, and what we're hoping this training will allow you to do is to add another layer to the reporting that you're already doing, and that you can sort of really work to help your readers understand that what I'm doing for my heart in my 40s and my 50s is going to affect my brain in my 60s, 70s, and 80s. And then when we get to older adulthood, so this is sort of something that's reasonably interesting. In countries in Africa, older adulthood is considered 65 plus. It's not actually what we would consider older adulthood in Europe or in North America. That would be considered 75 plus. So this is an aspect that maybe some of you are aware of already, which is that NCDs and risk factors for brain health tend to impact people who are living in low and middle income countries at earlier ages than in high income settings. So that's just a slight aside, but I think the important thing here for us to remember about older adulthood is, one, aging does not equal dementia. So dementia is not a normal part of aging. Aging does bring some changes to brain function, but dementia is a disease that is quantifiable and objectively diagnosed. So in your older ages, the diseases that are important and the risks that really increase are your risk for stroke and for dementia. Sorry, and I wanted to say again, normal aging brings some memory changes and slower processing, but dementia is a disease, not a normal part of aging. But what matters at this age? Social connection, loneliness and social isolation are major risk factors for cognitive decline, and also for making the cognitive decline steeper and quicker. Physical activity remains important. It's never too late to benefit from movement. And it's also important that things like physical activity have wider impacts than just improving your heart and your brain health. They do things like help preventing falls, and falls are a leading killer of older adults. Continued cognitive engagement. So these can be things like continuing to learn new skills, continuing to work well into your older years, as well as managing chronic conditions like high blood pressure and diabetes. And even in older age, control matters. And just for some context that I'm sure you're well aware of, in Kenya, family structures are changing with urbanization. Elders maybe become more isolated, particularly if they continue to live in rural areas, or if children, even in urban areas, are moving to larger urban centers. and elders care services are limited. There's also stigma around dementia, and families may hide affected relatives, particularly because dementia is not just does not just come with problems with memory and forgetting, but can also come with behavioral problems as well, which can be quite difficult to manage. So for journalists, and then the other thing, of course, is that many elder people age into poverty as they're no longer able to work and maybe not have family to assist them. So for journalists, aging in Kenya, it's changing very quickly, but services and support are not keeping pace. And these are urgent and often undertold stories in the Kenyan context. You can do things like profile community support networks, investigate elder care gaps. You could also do work to challenge stereotypes about aging and humanize people living with dementia. These stories matter and they're not being told enough. Think about it. When was the last time you wrote a story centered on an older Kenyan adult that wasn't about poverty or victimization? What could we do to write about asset-based aging stories? So aging well, aging not being a time of deficit or decline.